Good afternoon, everyone. You are very welcome to the HSE Masculinities and Men's Health. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host, Lorcan Brennan, Training and Resource Development Manager. Thank you.
Hello, everybody. My name is Lorcan Brennan, as Selena has just said, and thanks, Selena, for reminding us. Our team were there in the background from IMS and to do really great work for us when we're on here as part of our webinar series. As I say, my name is Lorcan Brennan from the Men's Development Network, and I'm delighted to invite you to be part of this webinar with us on behalf of our partners. Now, as you know, we were here last year, and our partners continue to be the same partners as we had before. So we have with us the HSE, we have IT Carlow, we have the Men's Health Forum in Ireland, and we also have ourselves the Men's Development Network. Now, over the next number of months, it is our hope and our dream that we're going to bring you along on 4 webinars. The first is going to be today, and we're going to have one hopefully for Men's Health Week in June. And then we'll follow up in September as well in the early autumn. And our final one will be for International Men's Day in November. Last year, I think that's the way we went as well. And we had really good feedback in relation to the webinars, and people I think really enjoyed attending. So today is indeed on masculinities and men's health. And as you know from the advertisement, the focus is specifically on farmers' health. And we have some really lovely people here with us today who are going to help us to explore all of that. And so we do hope you stay with us, not just for today, but indeed across the series of webinars as well. So as advertised, today is about farmers and masculinities. And to help us do that, as I say, we're going to bring you a number of people for presentations, and we also have a lovely group of panelists. I have somebody coming along very soon, Noel Richardson, who you probably know from past presentations as well along the way. And I'll say a little bit about Noel in a few moments. But Fergal Fox will also be here later from the HSE, and Fergal will bring us up to date on all the updates that are going on, I suppose, in relation to men's health, around International Men's Day, around Men's Health Week, and other different bits and pieces that we might need to know about as we go on in the webinar, but that'll be later on. Helene has already said about the Q&A, so if you do have any questions or you have any observations, please use our Q&A and we'll come back to you through that. So as I said, today we have some very interesting presenters that are going to be here with us, but before I even begin, I think contextualizing what we're about to do is really, really important. And it's very important to start with a note that not all farmers are men. That's a really important starting point. But within the context of today's discussions and explorations on masculinities, it's important to highlight the following, that the focus is not about who we are biologically, as in male or female, but more the discussions will be around exploring the behaviors, the actions, the perceptions that are most associated with being male and the implications of that for men's health or male health. And to begin our exploration, no better person really, I suppose, to start building on the conversation is Dr. Noel Richardson. Now, Noel is the director of the National Centre for Men's Health at the Institute of Technology in Carlow. He is seconded half-time to the HSE with responsibility for men's health policy and implementation. He says he's been a student of masculinities and men's health for over 20 years, and the title of his presentation is Turning the Gender Spotlight on Men's Health, reflecting on 20 years of research, policy and practice. So Noel, over to you. Great you're here with us.
Thank you, Lorcan, and good afternoon, everyone. I'm delighted to kickstart this webinar series on masculinities and men's health. And I think it's really timely to reflect on 20 really productive and innovative years of research, policy and practice in this space. So just to set a kind of an overall context for the webinar series, I'm going to say a little bit about what we mean by gender. I'll talk about how gender shapes men's attitudes to their health and their health behaviors. And I'll talk a little bit about what gender sensitive or gender specific approaches to engaging men looks like. Okay, so what do we mean by gender? And when we talk about gender, is it the same as sex? So the quick answer to that is no, it's not. So sex refers to, as Lorcan said earlier, biological or physiological differences between males and females. Gender, on the other hand, refers to behaviors or patterns of activities that a society or culture deems appropriate for men and women. So we say then that gender is socially constructed, it's about doing, and it's about understanding behavior in particular social and cultural contexts. So that all sounds relatively straightforward, or does it? Well, this gets kind of interesting really when the lines between sex and gender become blurred. So this is a conversation I had with Paul in one of the first study I ever did in this area. And I was asking Paul about his kind of reluctance to go to the doctor to seek help. And I asked him, you know, he said, he talked about being afraid of being laughed at or rejected, I suppose. And I said, where does that come from? And he said, well, it's something inbred in men, I suppose. It's in our genes. So this is a really interesting example of how men's kind of gender differences in health become almost sex differences, in that, you know, behaviors that should be seen as culturally or socially constructed become ingrained as almost being part of our DNA. And the reason I raised this early on is for two reasons, really. One, sometimes men can feel that they're so set in their ways that they're incapable of change. And secondly, that service providers can see men as being hard work or not likely to engage in health practices or health programs. And of course, as we'll see later, this simply couldn't be the case. And when our approach to engaging men is right, men will engage and do engage in their healthcare. So we need to kind of separate sex and gender very much in our conversations in this area. As part of the Engage program, we do an exercise early on in the day's program where we ask participants to reflect on the way I was brought up, boys and men were expected to, and to finish the sentence. And this is a typical kind of word map of the responses that come back. And these might be seen as kind of associated with what we might call traditional masculinity or restrictive masculinity, sometimes toxic masculinity, all these terms. But in fact, as soon as that exercise, as soon as these terms start to come back, we begin to see, well, it's actually not quite that simple. Immediately participants will start to say, well, actually, that wasn't my experience. Or they might say, that might have been the case in my father's generation, but not mine. Or it might have been like that in my 20s, but not in my 40s. So it's really important that we look at gender as a dynamic social construct, something that's not easily boxed away into categories or fixed character types. So masculinity is more fluid, it's dynamic, it's subject to change over time, and does change over time. So this is an example, I suppose. I grew up in the 1960s at a time where gender roles were very much fixed around kind of more patriarchal, heteronormative dimensions. So males and females had specific roles in society. In fact, Women's Own had a manual in the 1960s as to how women should cater for men on the transition home from work in the evenings, which is obviously things have changed dramatically in that time. Maybe not to the extent that we would hope to, but certainly there's been dramatic changes in gender norms over that period. It's also useful to think about masculinities in the plural rather than in the singular. So this isn't meant to be a definitive list or anything, but all of these embody different types of masculinity that find traction or currency in different sociocultural contexts. What's really important to note as well is that masculinities are defined around power relations, both between men and women and between different subpopulation groups of men. So a more dominant or hegemonic masculinity is the most honored or desired form of masculinity, typically embodied as white, middle-class, heterosexual, highly educated, employed men. But it's also important to point out that male power is simply not held by individual men, but is institutionalized in social structures and ideologies that support the gender order in favor of men. So we need to understand masculinities not just in terms of behaviors of individual men, but as part of wider social structures like schools, employment, employment sectors, sporting arenas, and so on. So let's just take an example then of how gender influences or shapes health behaviors in men. And a really good example, and there's a whole body of literature in this area, which is to do with men's reluctance to seek help for mental health, or in particular depression. So if you go back to the image I showed you earlier of kind of more traditional notions of masculinity, these sometimes can run counter to help seeking. So in other words, some men would feel that seeking help for depression is a betrayal of their independence, their strength, their autonomy, their control, and therefore will persist with not seeking help and trying to manage the condition themselves. And unfortunately, then, in trying to do that, men often self-medicate through excessive alcohol consumption or substance misuse, a form of maladaptive or masked depression. So we often talk about men acting out in coping with depression, through anger or aggression, for example, and trying to manage the condition through self-medication. But what's also interesting then is that help seeking can also be reframed as a masculine and manly choice. So there's a lot of interesting literature, say, that looks at men as firefighters, for example, and how seeking help in a timely fashion is the most honored and manly thing to do to preserve their role as firefighters. Similar work has been done with fathers, say. So to be a good father is to seek help and to stay well in order to execute the role of a father. Okay, so just in the last few minutes then, just talk a little bit about gender in relation to policy. Some of you may know, some of you may not know that Ireland was the first country to have a national men's health policy. And what that offers then, something really important, is that it applies the gender lens to our Healthy Ireland national policy framework document. And we've just come to the end of a second 5-year iteration of that men's health policy document called Healthy Ireland Men. So we're very fortunate that we've developed a national men's health policy that applies the gender lens to other policy areas and points the way for more effective engagement and programming for men. So to sum up then how gender is defined within the context of national men's health policy. Firstly, as we said, men's health practices can be mechanisms for doing gender. So for example, if we take binge drinking in boys, this isn't just a characteristic of boys. This is young boys and young men trying to make the transition from being a boy to a man and to go through that kind of initiation process. So binge drinking becomes the mechanism to demonstrate masculinity. These practices typically reflect wider cultural and institutional masculine ideologies. So drinking is very much part of the culture. If you look at, say, advertising, for example, through sport and alcohol, there was a really effective ad campaign a number of years ago, Not Men But Giants, which I won't name the product, but that's just an example of how alcohol becomes institutionalized within the culture, as it were. As I said, there's a multiplicity of masculinities. These change over time, and what gets currency at any given time is also changes. There's value in adopting a relational approach to gender. So it's not just about asserting one's masculinity, it's about avoiding the ridicule, as it were, of being seen as feminine. So very often health practices might traditionally have been seen as more feminine practices that men were keen to avoid. And finally, gender interacts with other social hierarchies such as class and ethnicity. So it's really important to adopt an intersectional approach. So finally then, this is just a kind of an overview of some of the really good work, as I said, that has gone on in the last 20 years. Diana will speak later about this in relation to farmers specifically, and David as well. So I think we're really fortunate to have put together a really important body of work at a policy, research, practice level, lots of really good toolkits and training resources that inform practitioners on how to effectively engage men. So very finally, what does a gender-specific or gender-sensitive approach to engaging men look like, or men-friendly, if you like? So these are some of the things that we've learned through this important body of work. So finding the hook, what appeals to men, what might be likely to get them in the door in the first place, and then to develop more elaborate or long-term programs at a later stage. Reaching out to men in community settings. So Sheds for Life, for example, Men in the Move are good examples of that. The focus on doing, men like to be practically engaged, connecting masculine ideals such as autonomy, control, and resilience with being healthy. So seeing health practices as being the manly choice, as it were, and taking control of health is really important. Using positive messaging to promote change without amplifying guilt or shame. So strengths-based approaches are really important. And men hearing testimonials from other men really is important for engaging. And then other men-friendly approaches, such as in particular peer support and camaraderie and team spirit, have been shown to be highly effective in engaging men. So that's my context setting. I hope that provides a platform from which to really delve into some of the more specifics today on farmers and in future webinars and other population groups. Thank you very much.
Thank you very much, Noel. That was absolutely an excellent overview and introduction to where it is we really do wish to go today. So much to take away from that and bring it on into our panel discussion later on. So many different layers to it, especially in relation to, I think, gender and its influence on our health behaviours, and maybe for men, the reluctance to seek help as well. So we'll bring that along, especially to our panel. And thanks to Noel for that vast knowledge. And really good to know as well, as you mentioned, National Men's Health Policy, the first country in the world to have a national men's health policy. And it's not a greenfield site, a lot of really good work being done, and we're going to build on that. So look, I'm delighted to now invite along David Meredith, PhD, who is a Senior Research Officer at Teagasc in the Irish Agricultural and Food Development Authority. He's working within the Rural Economy and Development Programme. David works in close collaboration with colleagues in and across Research Directorate and at the Teagasc Farm Advisory Service to design and implement research that tackles pressing health and safety issues. Now, the current research programme they have is supported by 4 PhDs, a master's student, and a postdoctoral researcher. David will now give us an overview of the key health and wellbeing challenges that are facing farmers in Ireland, and I'm sure we'll be able to bring much of what he says also onto our panel discussion in a while. So over to you, David. Thank you very much.
Can you just confirm that you can see that presentation?
Yes, you just need to put it into presentation mode, please, David. Thank you.
Okay. Good afternoon, everyone. And thank you, Lorcan, for that very nice introduction. So Noel has provided an excellent overview of many of the conceptual issues that we're engaging with here today in terms of men, gender, and masculinities. And I'm not going to go back there, but I'm going to build on that. And specifically, I'm going to talk about safe and healthy farmers and the importance of understanding that social context. And the safety element is in many ways quite obvious. Agriculture is a particularly dangerous industry. The healthy side, and we're going to hear a lot more from Diana very shortly about the health of farmers, is an area that we are particularly concerned about, or as concerned about as the safety issues. And when we stand back and look at the issues confronting farming, well, there's obviously the farm-specific elements here, but there's also the fact that we're dealing with gender and masculinity in here as well. And this makes it quite a complex area. So,
Sorry, David, apologies for cutting across you. We're actually seeing your full screen and your notes. So okay. You just need to pop it back into presentation mode. You might have to reshare again if you don't mind. Thank you.
Okay.
If you can just pop to the top of the screen where it says display settings for me.
Yeah.
and just the next one over. And if you can just swap view. So where it says display settings to the right of show taskbar, and click on the little arrow there for me, and just say swap presenter view and slideshow. Thank you so much, David.
Thank you for that. Apologies. Okay, so
I'm so
back.
sorry, David. It's still coming up wrong.
Okay, I'll tell you what, I'll just...
I was going to say, I might just ask my colleague to share your slide deck for you, if that's okay. 1 second now, David, thank you.
Apologies for this. You would have thought after 2 years that I would have mastered a Zoom presentation, but clearly not.
No, we all have those moments, David. It's on the way to you, so you'll be ready to rock and roll now in a moment.
Yeah. Well, I'll just finish that intro section. So in terms of the challenges that we see with regard to men and men's health, we know that they're 4 times more likely than women to commit suicide. And we know they're 20 times more likely to die from work-related accidents. And this is a particular issue in the agriculture sector, which accounts for a disproportionate number of accidents, and particularly fatal accidents. And biological differences between males and females don't explain the gap in health status. This difference is largely explained by practices or behaviors that men engage in. It is these practices and their consequences that are bad for health. And this is particularly true for farmers. So in terms of my presentation today, and I'll move on to the next slide now. In terms of my presentation today, I'm just going to briefly cover a number of issues here. But before I do that, for those of you who maybe don't know Teagasc or only know a little bit about Teagasc, you might be wondering, well, why are Teagasc involved in this space at all? And it's our vision that we as an organization can support farming in Ireland to be as sustainable as possible. And of course, sustainable development consists of a number of different dimensions. The environmental or ecological side tends to get a lot of coverage, but we also have the economic and the social side. And from Teagasc's point of view, the social sustainability is captured primarily in our plans around making farms safe for work and home life. And associated with that, we've got the aspect of healthy farmers as well. And there are 3 dimensions of Teagasc, as was mentioned by Lorcan at the outset: research, knowledge transfer, and education. And the work that I do involves collaboration right across those 3 different directorates as well. So if we move on to the next slide. So in terms of the type of work that we do and why do we take the approach that we take? So frequently we can, when we talk about health and safety of farmers, or we see discourses around health and safety, we can get the view, and it's normally accompanied with a roll of the eyes, a wry grin, and the statement of, sure, that's farmers for you. And that's really problematic because it suggests A, things are not changeable, and B, that all farmers are similar in some way. And Noel has pointed out that that isn't the case, that we've got generational differences between men and their attitudes and their behaviors and so on. But farming presents a particular problem or challenge in this area, and I'll talk about that in a moment. But conventional approaches to occupational safety and health and improving occupational health and safety focus on education and awareness raising, regulation and enforcement, and engineering solutions. And each of these has a place, but these approaches have come under increasing criticism because there's the realization that even if you do all of those things properly, you provide the education and awareness raising, you do the regulation, and you provide the engineering solutions, you still might not have much of an impact on occupational safety and health. And a number of researchers have concluded that we need to be thinking about health and safety in a very different context, and that's the social context of it. And the research that's emerging in this area is, and risk-taking here relates to both occupational risk-taking, but also health risk-taking. Okay, so risk-taking is fundamentally conditioned by a set of factors, including the behaviors and practices of the individual. But it's not just the behavior and practices of the individual, because they're influenced by the farmer's social induction from childhood into the occupation and the physical work environment. So farming, I talked about the challenges associated with farming earlier on. One of the fundamental ones is that people are inducted into farming as an occupation from a very early age. Okay, so as a child, you may be down helping out feeding animals or taking care of calves. As a young teenager, you might be up on the tractor helping out doing something. So from a very early point in life, farmers are being socialized into the work. And Sally Shortall and colleagues have undertaken work in the UK and argue that farm families are socialized in ways that normalize risk-taking. And this is also true of health behavior. And this means that accidents and ill health are normal or to be expected. And it highlights that we need to consider not just the source of dangers or risk to health, but also how work is done on farms and how people are introduced to that work from a very early stage. And this is where the intergenerational aspect of understanding health and safety behaviors becomes really important. And if you can move on to the next slide, please. So to do this, we've been using what's known as a socio-ecological model and SEM. And that foregrounds the significance of the relational nature of the processes that underpin occupational safety and health. And there's a couple of key points here. So there are multiple levels in this that extend from the individual farmer into their family setting, which is then embedded within their community and industry. And then we have a policy and governance framework and societal overlay on top of that. And each of these distinct levels influences what's happening. And this highlights the complexity of understanding what is shaping behavior and how we can maybe change some of the practices that we want. And the example that I give here are that we as consumers, every time we buy a product, affect the conditions under which food is produced, and hence the working and labor conditions on farms through our food choices. And that directly impacts on health and safety. So the key point in this model is that it recognizes that influences and relationships impact people differently based on their cumulative and intersectional characteristics and experiences. So this is where two farmers may be similar in many regards, but have completely different responses to a set of stressors or mental health issues. It also highlights the fact that these are nested relationships. So there's a fluidity between these various different levels, that there aren't discrete boundaries around any of these things. And critically, and this is really important, it doesn't place the onus to change or adopt new behaviors on the individual, but it considers the various levers or supports that are required to enable change. So one of the examples here is that rather than focusing on the need for a farmer to change, what some of our research does is works with farm advisors in terms of trying to find out the best ways of bringing in topics of health and safety to discussions with farmers. And what are the supports that those advisors require in order to do that successfully? So if you move on to the next slide, please. So this is a very brief overview of the work program that we have in place at this point in time. And as you can see, there's a lot going on there, but it all aligns to Teagasc has a strategic goal, and that's to secure farmer health, safety, and well-being. And we've broken this down, or I've broken this down into 3 thematic research areas, one focused on safety, another on health, and another on well-being. And that health and well-being, I mean, it's a bit of an artificial division, But we're going to hear from Diana very shortly around the Farmers Have Hearts project, and she'll talk a bit about that. But the key outcomes to these particular projects, and some of them are ongoing, focus in on designing different types of interventions, finding out what's suitable, what works, and under what conditions it works. And that generally involves a lot of work with farmers themselves, but also other people within that social ecological model that I spoke about there. And that's why across the bottom of the screen, you can see that very large number of logos from various different organizations who are involved in this work. And I'm going to move on to my last slide now.
Just 1 minute, David, if you don't mind.
So just in terms of summing up, the key challenges around influencing farmer practices to try and support them to be healthier and safer are very much embedded in the culture of farming. And that culture varies between households and also varies between localities. And we can see this in terms of some simple things, and it might seem funny to some extent, but the idea that somebody in a locality gets a new tractor and then all of a sudden everyone needs a new tractor. But we're going to be teasing out some of these particular issues and why they're so important at a seminar on farmer wellbeing and mental health, which is taking place on May 16th in Ashtown in Dublin. And we'll be hearing from David Christian Rose, who's just completed work on these types of issues within the UK, and he'll be coming over and talking about that work. But we will also be bringing together the people in Ireland who are currently working in this space to get a much better understanding of really who's doing what are they focused on, which populations are they focused on, and if they have results, what are those results telling us? So I'll finish up on that point and look forward to the discussion later. Thank you.
Thank you very much, David. And again, the complexity and the insights that you've brought to our audience today are just really immense, you know, and we're going to bring, again, some of what you've been speaking about and bring it maybe to our panel at the end as well. So we really, really appreciate your input and being here with us today. Really, really interesting. Now, look, before we have our next presenter, just we have a short video and we'd like to show it to you. And it's a brief video from the launch of the event of Farmers Have Hearts. And with a few words from our Minister, Frank Feehan, who, as you know, is the Minister of Public Health, Wellbeing and National Drug Strategy. And we also had Minister Martin Hayden, who is Minister for Research and Development, Farm Safety and New Market Development. Now, the video captures nicely some of the people who attended the launch and also has input from two of our partners, the Irish Heart Foundation and Lambia. There was a wide array of partners who were at the launch, and indeed many of them are here as well with us today. So we're just going to ask you to sit back. It's only a short video and have a look, and it will set us up nicely for Diana, who's coming on afterwards for her presentation.
I'm delighted to be here this morning along with my colleague Minister Frank Feehan from the Department of Health to jointly launch this really important report into the research carried out by Diana and all the team in Farmers Have Hearts. This is a really important role for the Department of Agriculture to support, because what we're doing is investing in farmers' health and well-being. And as Minister with special responsibility for farm safety, there's an inextricable link to farmers' well-being and farm safety. They're all very much encompassed. So this work is crucially important. Diana and all of the stakeholders involved have done a really fantastic job, and the results of it are very evident that through this engagement we are helping farmers to have better health outcomes, which is really, really important. So I commend everyone involved for the work and delighted to be involved here today.
I would like to thank all the contributors and indeed my colleague Minister Martin Hayden from the Department of Agriculture and the many partners in this work. It really is a fine example of collaboration across departments. The Farmers of Heart programme has shown what can be done supporting men in a very complex environment, and this initiative I know will save many lives. Again, I look forward to working with all the various stakeholders and progressing this initiative now and in the future.
The Irish Heart Foundation is delighted to collaborate with our partners on the Farmers Have Hearts cardiovascular health programme. The Irish Heart Foundation provided heart health checks at 0 and 52 weeks, and our nurses were delighted to be out in the marts and agri branches engaging with farmers and supporting them in their lifestyle behaviour change journey. Cardiovascular disease is one of the leading causes of death and disability in Ireland, and the Irish Heart Foundation believes that tailored interventions with a gendered approach make a real difference in terms of supporting people to improve their heart health.
Glanbia Ireland is really pleased to be involved in this collaborative study. It's been really beneficial to our farmers to have the opportunity to participate in this programme at 16 agri branches, and the results of the study have generated really beneficial research which we can now put into practice in terms of helping our farmers get beneficial health outcomes. We're really thankful to all the partners, to Carlow IT and to Teagasc and the Irish Heart Foundation for this collaborative project, which has been really beneficial.
Now, having a moment there trying to start the video again. Now, that is a really good introduction for the next presenter who's coming our way. It's Diana. Diana's all the way from the Netherlands, Diana van Doorn. And she comes from the Netherlands with a huge amount of experience. And as you see, she was very involved in relation to Farmers Have Hearts. And she's going to come on now and she's going to speak to us and tell us a little bit about the findings. Diana, it's great you're here, and thanks very much. So it's over to you. That's quite an introduction.
Thanks, Lorcan. I'm delighted to be here, and I'm delighted to present to you today the Farmers of Hearts Cardiovascular Health Programme. And today I will be focusing on engaging with farmers in the programme. I talk a little bit of why Farmers Health and the programme. I fly through the main results and then focus on the engagement piece. Why is my Oh, there it is. So why Farmers Health? Although farming is perceived to be a healthy and active occupation, Irish research showed that farmers in the working age have 7 times higher mortality from heart disease compared to those in salary jobs. And factors underpinning farmers' health are socio-economic. Many farmers in Ireland are considered a lower socio-economic group, and there's a huge variety in farming family income between enterprises and farm sizes. And in heart disease, there's a strong social gradient. For example, premature mortality from heart disease is higher among men in semi-skilled jobs compared to those in other occupations. Farmers tend to have a lower educational attainment compared to other occupation groups. Rural living conditions, you can think of breakdown of rural Ireland, younger people moving away, the closure of social and health services, access to health services. Farming occupation, think of unsociable hours, 24/7 responsibility. It can be a lonely job. Farmers experience high levels of occupational stress. And often also this stress is linked to low job control. You can think of uncontrollable factors such as the weather or animal diseases. Gender is also a factor. Farming is predominantly a male occupation, with 86.4% of the farm holders being male. And premature mortality from heart disease is higher among men compared to women. Masculinities also play a role. And we worked on the premise that the majority of farmers would adhere to more traditional and rural masculinity. And this is based on Irish research, which found that the working identity is highly valued. And this is linked to the perception that being healthy is being able to work. And farming is often prioritized over health, and farmers tend to respond to ill health rather than to engage in health prevention. And my colleague Connor, who's in the panel today, his work is adding to these notions of rural and farming masculinities, and he found that farmers valued bodily decline as a sign of hard work and help seeking as non-masculine. So the Farmers Have Heart program is a workplace cardiovascular health intervention targeted to farmers. And we were recruiting farmers at marts and agri branches. The program consisted of a health check at baseline and week 52. And we measured a full lipid profile, blood glucose, blood pressure, BMI, and waist, as well as lifestyle risk factors for cardiovascular disease, such as smoking and drinking habits, physical activity levels, and stress experience. The health checks were carried out by nurses from the Irish Heart Foundation, and then were closed by tailored lifestyle counseling based on the outcomes of the health check by the nurse. All farmers were then offered to take part in a health behavior change intervention. And there were 3 delivery methods. We had a health coach by phone, which consisted of 6 phone sessions in a period of 9 months. mHealth by text messages, consisting of 3 to 4 text messages per week for a period of 4 months. And farmers could choose a combination of both interventions. And those farmers not interested in taking part in a health behavior change intervention were placed in the usual care group. So they still received the baseline and repeat health check and a midpoint follow-up. We visited 12 counties, 16 mart and 60 agri-branch locations. At baseline, 868 farmers participated in the study, and at week 52, 62% of the farmers returned. Now, in research, we always look for high numbers of farmers coming back or participants coming back. In this case, it wasn't all bad news that farmers chose not to return for the week 52, because some were now in the medical system and chose to stay with their doctor's health checks rather than to come back in the program. So a quick summary of the baseline health findings. 74% of the farmers were found to have 4 or more risk factors for heart disease. We had 11 risk factors which we measured this on, and people with 4 or more risk factors for heart disease have a 3 times higher risk for an acute cardiac event compared to those with fewer risk factors. 75% of our farmers were advised to visit their GP based on the health outcomes during the baseline health check. And there was a high level of unawareness of having clinical risk factors for heart disease among the farmers. We also found that farmers were a heterogeneous group based on their social and farming characteristics, as well as the cardiovascular health outcomes. And this often seems like a very logic finding, but I find it a very valuable finding because we often talk about farmers as one occupation group, and acknowledging that there's different subgroups within this occupation group can help to inform tailored messaging in health promotion or health and safety campaigns. I also hope that this could kickstart further research to get an understanding why these social and farming characteristics, including gender and masculinity notions, affect farmers' health outcomes in a different way. So at week 52, we saw that 41% of the farmers had improved their multiple risk factors, and we saw a 6% decrease of proportion of farmers with 4 or more risk factors for heart disease. We saw significant improvements in blood pressure, blood glucose, smoking, standard drinks per week, physical activity, and stress and well-being levels. At week 52, we also saw that 81.5% of the farmers reported having made health behavior change, and of them, 84% said that they had integrated it in their daily lifestyle. So they went from contemplation to making it a habit. 82% of the farmers reported noticing a positive health difference as a result of making changes. And at week 26, we asked farmers if they had followed up with their GP after being advised during the baseline health check, and 54% of the farmers confirmed this. So what were key factors underpinning this program? We worked in a transdisciplinary partnership which consisted of the National Centre for Men's Health at IT Carlow, Teagasc, the HSE, the Irish Heart Foundation, Glanbia Ireland, and UCD. Together we brought funding, which is important to do research, and expertise in research, farming development, community health practice, policy, and industry. Although we came from very different angles in this program with the different organizations, we worked together towards a shared goal of improving farmers' health. And this contributed to broadening of the reach to the subgroups and access to the subgroups of farmers, the acceptability of the program among farmers, and allowing the program to be trialed in a real-world setting and real-world practice. The design of the program was evidence-based and informed by best evidence derived from Ireland's long-standing experience in men's health and previous experience with farmers' health research. Engaging with farmers was at the heart of the program, and we integrated various strategies for engagements. The program design was informed by gender-specific and strength-based approaches, and we worked with masculinities rather than against these values. And this led to cultural adaptation of the program. Maximizing engagement was at the heart, in which the farmer was seen as a partner in their health prevention and their change of lifestyle. In order to realize this, we needed to create a platform of trust, safety, and provide farmers with control and autonomy. The program was made accessible for farmers. We visited regional, geographical, and rural areas, and we worked setting-based. We adopted a non-judgmental attitude, creating a safe space for farmers. The health checks and the interventions were free of charge for participants, so there was no financial barrier to take part. We offered farmers tailored information to individual health needs in plain, positive, and accessible language. And this contributed to understanding of health impacting factors. We used positive methodologies such as motivational interviewing and increasing self-efficacy. And this information led that farmers could make shared decisions about their lifestyle and the interventions and how to improve their health. And we provided options and choice to the farmers. The farmers were partners in their health prevention, and all the staff was trained in men's health. So that were the nurses, but also the research team members. And although we were all from different organizations, we worked together as a transdisciplinary team, and we had regularly follow-ups with the farmers. So on the floor, that's translated into practice that we met farmers on their turf in local mart and agri branches, a space where they felt safe, comfortable, and respected. All our contacts were based on building rapport and a personal approach. We all adopted a non-judgmental attitude, so there was no naming, no shaming at all stages. And for example, at week 52, we developed a positive script to invite all farmers back for the repeat health check, regardless of making health behavior change. And this is in men's health research. We see that often, that those men who did not improve tend to not to come back for repeat health checks. We offered farmers factual information in plain language. All program elements were flexible and in keeping with busy farming seasons. Farmers were offered choice in time of health check, but also for intervention delivery model. And it was observed that farmers carefully chose which intervention would be most suitable to them. And that was in relation to the time they had available, practical things like the connectivity in their area, but also their health needs. On interpersonal level, the program tapped into the culture of the mart and agri branches, which was a local space. And mart and agri branch managers and all the workers were actively promoting the health checks and the program. By meeting farmers on trusted location, peer support was an important motivation for farmers. And in many cases, farmers were supported by other farmers to take part in the program. We visited all locations twice, which contributed to normalizing health in the working place of farmers. And this led to increased health literacy, empowerment, self-efficacy, and participant satisfaction and adherence, which was measured with open questions at week 52. So that was what we got back from the farmers who participated. So the program addressed several health and agriculture policies. We adopted gender-specific approaches. We targeted at-risk population. We worked towards taking responsibility and self-care among participants. We worked towards development in rural Ireland and increased quality of care of farmers, which is part of sustainable farming. And the learnings of the program can offer opportunities to inform the health and agricultural policies further. So what is next for the program? The evidence of this program is timely. The program was effective in engaging farmers in health, reaching those at high risk for heart disease, reducing cardiovascular risk for a large group of participating farmers, and supporting sustainable health behavior change. At the foundation of the program, we have established an effective working transdisciplinary partnership who have expertise and ambition to drive the program further. The program is ready for implementation, scale-up, and nationwide rollout. And continued research and evaluation will ensure program quality, fine-tuning of program elements to enhance impact and inform policy. The program directly impacted the health and well-being and lives of the participating farmers and their families. And my hope is to expand the program, broadening the partnership, but also making connections with local farmer health and well-being initiatives. And we have Laura from Fit Farmers today at the panel, which is an excellent example of a local initiative. And together we can work towards reducing health inequalities experienced by farmers and placing farmers at the heart of sustainable farming. Thank you.
That was super, Diana, a really superb program, and did exactly what you said on the tin. You've told us exactly about the program and its key findings and whatever. And again, the word partnership seems to scream off the slide, you know, that people working together to make a difference, and what really clear insight and finding that you have there. So really, really good. And we're definitely going to have to move along very fast. We're going to run for time here to bring some of the questions that we wanted to ask our panelists. So look, I'm going to invite on our panelists, some really good people here. Diana, thank you very, very much for that, as I say. And I'm going to bring on our panelists here to see, can we have some kind of a conversation for a while. And there's a number of people that are coming on here with us today. We have, first of all, we've Conor Hammersley, Comison Teagasc, a Fulbright scholar. He's based at National Centre for Men's Health in IT Carlow. His work looks to inform intervention strategies to support farmers' well-being. His research interests include gender and health, mental health, and suicide prevention in men. And he brings a huge amount of experience here to us today as well. Diana already mentioned Laura Tully has been providing evidence-based interventions for men in Roscommon since 2017. And to date, she supported Roscommon Sports Partnership with 111 farmers in Roscommon completing her Fit for Farming program. Excellent program as well, and workshops, physical activity workouts. So Laura, super that you're here with us as well. And then we have Jonathan. Jonathan's here with us as well, Jonathan Dwyer, and his colleague John Keane. They started what we call Make the Move, founders of that since 2019, when they were really alarmed by suicide figures in Tipperary, and talked to Healthy Ireland, and started something that has grown in its response, and really positive things happening there as well. And finally, we have Francis Bly, and Francis is from Teagasc, and he joined Teagasc back in 2005. He worked as a farm advisor until 2019, and when he took up his role as Teagasc Health and Safety Specialist. He works to support the delivery of the Teagasc Health and Safety Programme, which includes a strong focus on promotion of positive health and well-being among farmers in the community. And also, I've had the great privilege of being with Francis in some training settings. So, folks, we're going to be short on time, but we really do want to probably ask some questions based on what we've heard here today. really fantastic presentations. Fran, can I start with you, Francis? Just very basically, if you can come on there and just unmute your microphones, that would be really great. But just even before we start about talking about maybe some of the challenges or the difficulties, just to ask you maybe, Francis, about the things about farming that we love, perhaps, to start from a positive place. You know, when we think of the brand of it, when we think of how important it is to our culture, to our community, what strikes you as that, to stand on some firm ground before we begin?
Yeah, well, obviously, when everybody thinks about farmers, and I think about farmers, and, you know, I suppose I'm a farmer all my life, as we heard in the conversations earlier. Farmers are kind of cultured into farming very, very early in their age. And you go out and you start working with the animals, or you start working with the crops. And it's that environment there where you're building, I suppose, or you're providing a place for a farmer to, or you're the custodian of the countryside, I suppose is what I'm trying to say. I'm kind of getting muddled up in my words, but a custodian of the countryside. The environment is very much part and parcel of what you want to try and mind and keep. And all your fellow farmers are the people that you work with, and you rely on each other, and you're relying on industry to kind of make an income. But your main, I suppose, objective is to be proud about what you do and how you do it, and you know, to do each job that you do in the best way that you can.
And certainly that is the feeling that's there across the country. You know, when you're looking out across even your slide behind you, how you know how beautiful our nation is and how important farming is within the community. But Conor, if I can come to you just for a moment, because on the back of the celebration of what we love about our brand and about the environment and about the farming background, you have, through your research, especially in relation to on firm ground, you know, you were able to come up with some of the real challenges that are there for farmers. Can you just very briefly maybe name some of those challenges that are associated with the context of farming in Ireland based on your research?
Yeah, sure can, Lorcan. Well, I suppose it's against the backdrop of change in society as a whole, and then agriculture being so associated with society, or society being so dependent on agriculture, you know, obviously in terms of food, but also in terms of the environment. And much of that, I suppose, falls back then on the farmer, and hence, I suppose, farming becoming much more regulated to meet certain demands, you know, associated with the environment. And associated with that is, I suppose, inspections and cross-compliance and much more paperwork. And like kind of hitting on what Francis spoke about, the freedom and autonomy associated with farming, you know, is kind of being reduced to some extent from farmers. And that's, you know, innately associated with farmers' identity. And I suppose one of the key things that we've noted is that's kind of a very challenging message maybe for farmers in terms of them being able to exercise their own autonomy on the farm, and more deeply maybe their identity being challenged, and it kind of has knock-on effects for farmers' self-worth, if that makes sense.
That makes absolute sense. Laura, can I come to you for a moment, because I mean, you've listened back at the presentations, were all excellent today, and I mean, you could stay here for a week talking about different aspects of what was presented, because it was broad and specific. You're a practitioner, you know, and you're a nursing background, but you're also a practitioner who have brought a kind of, I suppose, health to farmers. Your own experience of that, like, because Diana was talking about some of the things we know that work. What has been your experience, especially working with farmers, and the context of what Noel talked about very much at the beginning, around masculinities and gender, and how we experience gender, especially, and act out on it in farming environments?
Yeah, I suppose even listening to Francis and Conor there, the thing I've kind of tried to do is take a farmer's pride, because pride is often the thing that stops them looking after themselves and their well-being. And I've tried to flip it in that, you know, if you can kind of support a farmer to take pride in themselves and prioritize themselves and their well-being, and to really focus on the fact that, you know, if they don't put themselves first, they won't have a healthy farm if they're not fit to farm. And I suppose, you know, it can be a challenge to get men and to get farmers to engage with that health and well-being. And the one thing that farmers will always tell me is, I haven't time, I'm too busy. And that's the masculinity, you know, coming in, that stereotypical, like, you know, farmers, when I started working with them, they were afraid to be seen, to be given the time to be at something in the hall, or to be out walking, or to be talking about their feelings and their well-being. So what I've done with that, and it might be helpful to people who want to work with farmers, is to try and flip that around and maybe get your peer leadership, you know, find a local you know, health hero, a local champion amongst the farmers, someone who's respected and, you know, admired by other farmers, and engage him first. And when he crosses the threshold, you'll see that there's a ripple effect where other farmers will, you know, see him as a role model and start to engage. So that's kind of been my secret weapon in over the years, and I recommend it to others, you know. And after that, then it's about access. It's about having a thing, you know, an intervention or providing the information, advice and support at a time that's convenient to the farmer. Availability, signposting, information, education, support. And what Diana and the other speakers mentioned was, you know, that traditionally, I suppose it might have been the woman of the house who looked after appointments and medical and prescriptions, and, you know, that masculinity, you know, helping farmers find out the how, what, when, where, how, and everything about looking after their health and well-being. So it can be as simple as that, I think.
Jonathan, I'm going to bring in on that because, I mean, I think it was David mentioned earlier on, and Laura's kind of talking about it as well there, the learned behaviours that maybe are not helpful, even in relation to health or safety. And the kind of the evidence that seems to come from all the speakers that we have, that there might be a kind of an Ironland approach to the culture of masculinities within farming, no matter who we are, male or female, you know, is in there. Was that your experience in your work that you've done in your own area?
Yeah, absolutely. So, I mean, when we first set up Make the Move, we had to go and go and find information about what was affecting people in our area. And I suppose we looked at a lot of international studies. We looked at New Zealand in particular. I was fortunate enough to have been over in New Zealand twice and met some of the rural support people over there. And their big thing around the masculinity side of things was to try and make it relatable to people, or relatable to farmers. So during our information sessions, we had two people speak, one young and one old, who had maybe had mental health issues. And when we found them, when we broke it up into our roundtable discussions, people could relate to those people who stood up and spoke. And as a result, then they were more free flowing with their information, and they could relate to what they were saying, and could say, well, you know, and what kind of following on from Laura, we kind of also try to get those people who are well known in the community. So then people were able to say, well, so-and-so, sure, he's a great farmer. Sure, I mean, if he's able to open up and talk about his mental health, well, surely I can do it. And we kind of have followed that through into a lot of our work that we've done. We had buckets. We were sponsored by HSE. We produced 5,000 buckets across Tipperary, and we gave them out in the co-ops and marts. And within that there's mental health leaflets in it. But again, we took the idea from what we've seen internationally of trying to hide the fact that it was about mental health, if that makes sense. So it encouraged then people, especially men, to take the buckets. They all thought they were free, and they all thought, well, this is great, it's going to be great for feeding calves. But actually, when they opened up the lid in the bucket, there was a whole load of mental health leaflets, and they could get the help or support or the signpost dental services in their local area. And kind of following on from that, then we've just developed our own farm champion training, following on from what Laura was saying. And that again is well-known people in the area, or in a particular area, that are well-respected farmers, again, that could go to their discussion groups, could go to the marts, could go to different events and talk positively about mental health. And I suppose following on from that, then we've also looked, again, going back to the international situation, you know, we know in New Zealand what they've done to try and get people to go to their events. They've gone and got a New Zealand All Black to go and talk at the start of it. So people will go naturally to see this famous rugby player, but then they have 10 or 15 minutes about their mental health, and trying to kind of almost hide the fact that, you know, it's maybe some of the mental health aspects, are trying to encourage people to talk about their mental health by, I suppose, trying to reduce that masculinity that's associated with it.
Yeah, and Francis, can I come to you just for a moment on that? Because that's really, you know, Diana talked about, and even early on, I think it was Noel talked about, you know, it's strengths-based approach, and, you know, that engagement. But, you know, the message of mental health that Jonathan has spoken about, you know, that there's still so much stigma around it. So to be able to find some kind of a strengths, or finding the hook, like, you know, finding ways in, really, really important, you found in your own work as well.
Very, very much so. Obviously, like, you know, the relationships that you build up with your farmer clients, you kind of know the family, you know the farmer, you know what they're interested in. And you try and kind of, I suppose, talking to farmers, you can bring in the the importance, I suppose, as Laura says, of prioritising themselves. They're the kingpin within the farm, and the important link, I suppose, to make sure there's an income there for themselves and their family into the future. And you try and, I suppose, make it as relevant as possible and provide as much information as you can. And it's important to try and do that. And it's important for all of us to try and do that for farmers, to use every opportunity that we can to give them messages and to encourage them to take care of themselves.
I'm just really conscious of time for us. I would have loved to have more time, but in the context of this as well, you all have really, from your own disciplines and backgrounds, you have huge experience. And it's one of the reasons you're here on the screen today. We're not a greenfield site. We're learning. The word partnership seems to come when I look at all the different initiatives. What do you think are the actions? What do we need to be doing in relation to, the awareness, the unawareness that Diana talked about, to be changing and normalizing the culture of behavior within masculinities, in the culture of farming, that can make it easier for people to seek out services and go where we need to go, Can I ask you that, Laura, first of all?
Yeah, I actually think we're coming on in leaps and bounds in this, Lorcan, since I started working in this area. And I think it's a really positive thing to note that there are now, little initiatives almost in every county. But I think the key thing is just going back to the same point. It's about access, isn't it? It's having it on the farmer's doorstep. And like the Farmers Have Heart programme proved, doing something where it suits the farmer, when it suits the farmer, seizing those opportunities, to meet and greet farmers and to make it, farmer friendly. So whatever it is you're doing, it has to be on those terms. And I think the other kind of simple, to keep a thing as simple and straightforward as you can. And it's really important then that the language we use to engage farmers and men is, what's farm friendly. So, removing kind of all the medicalized terms and just, I would use things like you're going to feel in better form for, to touch on mental health, because I find sometimes, the mental health coming at it too heavy can actually kind of present a barrier. So we talk about being in good form, about boosting your mood, about getting fitter, about being able to bend down and tie your laces a bit more easily, about, it's functional fitness, it's good form, it's just improving things from your baseline. And, that they're the things that farmers will comment on as being successful. So simple, straightforward initiatives, understandable language, access on the farmer's turf, as Diana said, and just kind of making sure then that the people delivering these messages or these interventions have a passion and a personality to work with farmers, because that's the whole kind of underpinning factor for me, I think, is to have that passion for it.
That's your experience. I can hear that very strong and clear. Conor, from the research point of view, what for yourself do you feel, or what's been coming back to you in the pieces you did for Firm Ground, whatever? What are the ways forward? Yeah.
Well, I think just reflecting on the talk we've had today, I think a very important thing is that any health programs or intervention strategies that are adapted to the cultural context that farmers operate in, to maximize their impact. And I think, kind of as Laura and Jonathan said, that can be done much more appropriately or efficiently in a kind of oblique way, in a kind of fun way, as opposed to coming heavy down on top of people with terms like masculinities and stuff like that. It can be done in much more of an enjoyable way that gets much more impact, because life and farming is heavy enough as it is. And if we can introduce these things and to show that health and well-being and engagements in these things can be quite a very enjoyable experience and social experience, I think that's much more appropriate way, as opposed to someone like a social scientist or gender researcher like myself coming in saying all the things that are wrong with masculinities. And we come at it much more from a kind of a healthier way, like Diana's work, and like what we're trying to do on Firm Ground, we're training advisors too as well, that people that can engage them, in relation to their own cultural and social environment, if that makes sense.
It does as well. And Jonathan, you've done exactly what Conor's saying on the tin there. I mean, you've been very much part of normalising the experience, like Laura, of engaging and supporting and shifting that probably restrictive, I think was the word Noel talked about, restrictive masculinities that be in the culture of farming.
Yeah, exactly. And it's the same thing. I mean, we have our own leaflets now where we've had people who've spoken at our events, and again, following on from what Laura said, you know, they wrote their story, but we didn't edit it, so it doesn't lose it's like it's the way they speak normally. So it's very relatable to people and relatable to farmers because it's the way they talk, or you know, in any of the education pieces that we would do, you know, instead of saying, well, we had an argument with my father, it would be, well, I don't see eye to eye with my old lad. And that farmers then can relate to that a little bit more than that. But also then I think the big thing is, and we touched on it, is the education piece of the consistent education. And as Conor said there, it's in that non-intrusive, fun fashion that people can relate to. Like, so for instance, we just got a piece of funding last week to now run a pilot program in the Taoiseach Ag Colleges. So it's trying to get people more, I suppose, in tune with their own mental health and not to have the stigma or that negativity that's associated with mental health.
The thing that I just add to that, Larkin, is the thing that I would just add, but that puts the responsibility back on us as opposed to the farmers in terms of adapting programs for the farming community, as opposed to us coming in a kind of mercenary way with it. You know, the burden of responsibility is on us as practitioners to, you know, engage things that are appropriate for the farming community.
Fran, can I give the last word to you, please, just in relation to what you think are lots done, but with lots more to do.
Yeah, well, like we've been involved in the On Firm Ground project, you know, for the last year or so, and very much important project to try and, I suppose, help advisors to help farmers, and it's working really, really well. And it brings in everything Laura said, Jonathan said, and Conor has said, and what we've heard in the research. Like, it's bringing groups of advisors together to talk about this, to come up with possible solutions and options, to have conversations with farmers and encourage them to get involved in these types of initiatives, like what Jonathan is providing, like what Laura is providing. You know, do things positively for themselves and be open to the conversation. And it's just a little drip approach of a little bit of information regularly helps it become more normal.
Very good. Well, the good news is it's not a greenfield site, and as you see today from the presentations and from the panel, you know, there's lots of really good stuff happening, and partnership approaches are really kind of really important in that. Thank you very much, folks on the panel. Really, really appreciate you being here, sharing your wisdom. Wish we'd more time, but I'm going to have to let you go, and I'm going to hand over to Fergal, who's going to come on just for a few moments to us, and he's some just updates and whatever. And thank you to everybody who has been here with us. So.
Thank you very much, Lorcan. I appreciate that. And Lorcan, I'd like to say thanks in particular for the way you've been chairing these webinars. And I hope, I know lots of people on here today, the participants may have tuned into some of the webinars last year, but if you haven't, they're all up on our YouTube channel, the series that we had on engaging men, we had a 4-part webinar series last year. They're up on our YouTube channel, and if you'd like to, I'd also invite you to subscribe to our YouTube channel to keep up with our video and information resources there. But look, thanks very much to all the participants and all the contributors to today's webinar. Sorry for eating a bit into your lunchtime. I just wanted to flag 2 or 3 things to you. What's up? Oh yeah, the Men's Health Week is probably be our next Men's Health webinar. And if you want to engage with Men's Health Week, we'd invite you all to engage with that this year. There's a real opportunity to kind of get out and do something face-to-face, reintroduce that social aspect of Men's Health Week. It's coming up in June on the 13th. Go to mhfi.org. We'll share the link, and we'll share it in the follow-up email as well. We'll share a few bits and pieces of health and wellbeing information for you, for the men in your life, for the men in your service, that you know, that you can update yourself on some of the health and wellbeing information resources that we have up on our own website, from Ask About Alcohol or our Quit service, our 28-day challenge. We'd share a couple of key points in the follow-up email. April is also Bowel Screening Awareness Month, so we'll share that, and I'd encourage you to just take a minute and read the webpage on the bowel screen. Just because if you do ever get an opportunity to, you know, to talk to a man, to normalize that, you know, registering on bowelscreen.ie is a new thing for men aged 60 to 69 and women, but men in particular will need that supportive nudge, I think. So I'd encourage you to do that. Our stress control program is back on, starting again next Monday. That's broadcast on YouTube. Again, we develop resources sometimes on video online. And we know, unfortunately, that without a supportive nudge, men are not going to utilize them in the same numbers as women, unfortunately. So we just want to flag that for you again. And Noel mentioned when he was talking about the policy context earlier on that we've just finalising this year, or we finished up last year on the Healthy Ireland Men Action Plan, the HSE Action Plan that we've been working from with a wide variety of partners. So this year we've commissioned Peter Baker from Global Action on Men's Health to do an independent review on that, and he has a survey, and we'll share that link to that survey in the follow-up email. And I really encourage you as a stakeholder in men's health or somebody with an interest in men's health to take the time to engage with that survey, because we're looking for a broad feedback from stakeholders such as yourselves to feed into the development of a new Healthy Ireland Men plan that we hope to develop later this year. But Peter Baker from the Global Action on Men's Health is doing that review, and you have an opportunity to feed into that review. So that's about it. I think it's very important that we focus on masculinity and men's health. So I'm delighted with these webinar series that we're doing this year, and really insightful presentations today. You know, I was listening to some of the presentations today. I was reminded of my own socialization into farming with my father and 4 brothers for years and years from a very young age, and how that kind of overwork was normalized. And I see my brother now trying to modernize the farm and work with my father as a staff member rather than being the boss. It's a very unusual workplace dynamic that's still very hard work, you know, physically demanding and mentally demanding. Like it's a challenging business to be in. So it's great to see more and more of these supports coming into place. And I'd just like to thank everybody once again for their support and the input, and for taking the time to listen. Thanks very much.